So, good evening, class. My name is Jason Sekilunya from BPID AP36. So, tonight, our lesson for tonight is all about danger of drinking alcohol. So, let's talk about first the most essential learning competencies. So, number one, describe the harmful short and long-term effect in drinking alcohol. Number two, interprets blood alcohol concentration or BAC or what we call BAC or BEC in terms of psychological changes in the body. And the last is explain the impact of drinking alcohol in the family and community. So self-check. So I will give you a short activity which what we call self-check. So you're going to respond or write it is me or not me in each statement. Count the total number of it is me responses for interpretation. So response it is me or not me in each statement. Count the total number of it is me responses for interpretation. So okay. So I have 10 sentences here. So number one, I had a drink mix of alcohol. I drink alcohol beverages every occasion. I drink alcohol beverages every day. I can consume 2 to 3 bottles of alcohol beverages in just one set. Number 5, I drink alcohol beverages to forget my problems. Number 6, my family and friends ask me to stop drinking alcohol. Number 7, I feel relaxed and relieved when I drink alcohol. Number 8, my grades are affected of my drinking of alcohol. Number 9, I find it difficult to resist when someone invites me to drink alcohol. And number 10, I escape classes just to go with my friends drinking alcohol. So that is the 10 sentences and I will give you 5 minutes to answer those statement. So okay, time's up. So now let's count the total number of it is me responses for our interpretation. So if you score 0, well, congratulations, you are not into drinking of alcohol beverages. But if you score 1 to 3, you are on your way to be independent in alcohol beverages. And if you score 4 to 6, your health is at risk. Maybe you are now dependent on alcohol drinks. And the last, if you got a score 7 out of 10, it means you need help and you are seriously alcoholic. So let's talk about the three types of alcohol. So number one is what we call isopropyl, antiseptic or rubbing alcohol. So this kind of alcohol is what is alcohol that we use in disinfecting our hands, especially in now with we are engaged of COVID-19. So the second one is what we call methanol, used as industrial solvent and fuel. And the most common are the last one, which what we call ethanol, or also called as alcohol beverages. So this kind of alcohol is the alcohol that we allowed to drink. So how drinking alcohol affect us? So control one's mental processes, memory, speech, learning, and decision making. It also affects person's senses, feelings, movement, and breathing. So the amount of alcohol that entered in the bloodstream at a certain period can be measured in percentage through blood alcohol concentration or what we call BAC, or most often called blood alcohol level or what we call BAL or BAL. So what are the short-term effect of drinking alcohol? The short-term effect of alcohol, more especially ethanol consumption, range from a decrease in anxiety and motor skill and euphoria at lower doses to intoxication, drunkenness, stupor, unconsciousness, anterograde amnesia, memory blackouts, which is common, and central nervous system depression at higher doses. So now let's talk about the long-term effect of drinking alcohol. So here are the long-term effect of drinking alcohol, which is it affects our health. Associated with alcohol intake in large amount include an increased risk of developing an alcohol use disorder, malnutrition, chronic pancreatitis, erectile dysfunction, heart failure, atrial fibrillation, gastritis, stomach ulcer, alcohol liver disease, certain types of dementia, and several types. So this is the few long-term effect of alcohol, but in fact there's a lot or plenty of long-term side effect in drinking alcohol, which is heart disease, liver disease, or even heat stroke. So that's all, and thank you.